8 signs of liver disease at night you shouldn't ignore. Did you know that liver disease doesn't take a break when the sun goes down? In fact, nighttime can reveal a unique set of symptoms that are crucial for anyone with liver disease to recognize. Identifying these signs can help you stay on top of your health and ensure a good night's sleep. In this video, we'll uncover the often hidden signs of liver disease that can appear at night. These nighttime symptoms offer important clues about potential underlying health issues. If you're experiencing any of the symptoms mentioned, please share your experience in the comments below. Let's raise awareness and support each other on this health journey. Don't forget to like, subscribe, and hit the notification bell for more health tips and information. Number 1. Nighttime muscle cramps. These cramps can be more than just a painful nuisance, they might be a signal of an underlying liver issue. Imagine being jolted awake by a sudden, intense cramp in your leg. Your muscle tightens and contorts painfully, leaving you rubbing and stretching in a desperate attempt to find relief. These cramps can last from a few seconds to several minutes and can recur multiple times throughout the night, making restful sleep seem impossible. The liver is essential for maintaining a balance of electrolytes and minerals in your body, which are crucial for proper muscle function. When the liver isn't functioning correctly due to disease, it can lead to imbalances in electrolytes like calcium, potassium, and magnesium, causing muscles to cramp and spasm. Additionally, liver disease can result in poor circulation and reduced oxygen supply to the muscles, further contributing to the frequency and severity of muscle cramps. To help manage and prevent nighttime muscle cramps, include foods rich in essential minerals like potassium, magnesium, and calcium in your diet, such as bananas, leafy greens, and nuts. Nuts, seeds, and dairy products. Avoid excessive alcohol and salty foods, as they can disrupt your electrolyte balance. Drink plenty of water throughout the day, and consider keeping a glass of water by your bedside in case you wake up thirsty. Gentle stretching exercises before bed can help relax your muscles and reduce the likelihood of cramps, especially focusing on your legs and feet. If you experience a cramp, massaging the affected muscle and applying warmth, like a warm towel or heating pad, can help alleviate the pain and relax the muscle. Number 2. Itchy skin. Picture this: you're cozied up in bed, drifting off to sleep, and suddenly you're hit with an intense urge to scratch. It's not just a mild itch, it's an unrelenting need to scratch that keeps you awake and frustrated. This itchiness can be localized or widespread and often feels more intense at night, disrupting your precious sleep. So, what's the deal with this nocturnal itching? Liver disease can cause a buildup of bile salts in your bloodstream. Normally, your liver processes these bile salts to aid digestion. However, when your liver is compromised, it can't filter out these substances efficiently. As a result, these bile salts accumulate and deposit under your skin, causing that relentless itch. If itchy skin is becoming a nightly struggle, here are some tips that might help. Use a good quality moisturizer to keep your skin hydrated, as dry skin can exacerbate itching. Apply lotion generously, especially after bathing. Hot water can strip your skin of natural oils and worsen the itching, so opt for lukewarm showers and use gentle, fragrance-free soaps to keep your skin calm. Over-the-counter anti-itch lotions or creams containing ingredients like menthol or camphor can provide temporary relief. Antihistamines might also help, but consult with your healthcare provider before taking any new medication. Keeping your bedroom cool can help reduce itching. Use a fan, lightweight bedding, and wear loose, breathable pajamas to keep your skin comfortable. In some cases, medications that reduce bile salts or address liver function may be necessary. your healthcare provider can advise you on the best course of action based on your specific condition. Number 3. Night sweats. If you're waking up in the middle of the night drenched in sweat, with your pajamas sticking to your skin and your sheets damp, you may want to look into why. These episodes can range from mildly annoying to severely disruptive, making it hard to get a good night's rest. Night sweats in the context of liver disease can be attributed to several factors. The liver is responsible for filtering toxins from the blood. When it's not functioning properly, these toxins can accumulate in your system, potentially causing your body to react with night sweats. Additionally, liver disease can disrupt the balance of hormones in your body, including those that regulate temperature, leading to excessive sweating, particularly at night. Chronic liver disease can sometimes be associated with low-grade infections or inflammation, which can cause your body to produce sweat in an attempt to regulate temperature. The liver also plays a key role in metabolism. Liver disease can alter metabolic processes, leading to changes in body temperature regulation and causing night sweats. It's important to speak with your doctor to determine if liver disease is the cause of your night sweats. They can run tests to diagnose liver problems and recommend appropriate treatments. Eating a balanced diet can support liver health, so focus on foods that are rich in antioxidants, vitamins, and minerals. Avoid alcohol and limit consumption of fatty, fried, and sugary foods. Spicy foods and caffeine can trigger sweating, so try to avoid these, especially in the evening, to reduce the likelihood of night sweats. Number 4. Insomnia. Imagine lying in bed, staring at the ceiling, and counting endless sheep with no sign of sleep in sight. Your mind races, your body feels restless, and as the hours tick by, you get more and more frustrated. Even when you do manage to drift off, it's a fitful sleep that leaves you feeling exhausted the next day. So, what's the connection between liver disease and insomnia? The liver plays a crucial role in detoxifying your blood and managing various metabolic processes. When liver function is impaired, toxins can build up in the bloodstream and affect brain function, leading to a disruption in your body's natural sleep-wake cycle, making it difficult to get a good night's sleep. Additionally, liver disease can cause imbalances in hormones and neurotransmitters, such as melatonin and serotonin, which are critical for regulating sleep. These imbalances can further contribute to insomnia. If insomnia is becoming your nightly nemesis, here are some tips to help you manage it. It's essential to see your doctor if you're experiencing persistent insomnia. Blood tests can help determine if liver disease is the underlying cause, and your healthcare provider can recommend appropriate treatments. Establishing a calming pre-sleep routine can help signal to your body that it's time to wind down. This might include activities like reading, taking a warm bath, or practicing gentle yoga or meditation. Try to go to bed and wake up at the same time every day, even on weekends. Consistency reinforces your body's sleep-wake cycle. The blue light emitted by phones, tablets, and computers can disrupt your body's production of melatonin, making it harder to fall asleep. Aim to turn off screens at least an hour before bedtime. Make your bedroom a haven for sleep by keeping it cool, dark, and quiet, and invest in a comfortable mattress and pillows. Before we cover the next symptom, don't forget to like and subscribe. Number 5. Restless leg syndrome, RLS. Restless leg syndrome can be a real nighttime nuisance, and it might surprise you to know that it can be linked to liver disease. Imagine settling into bed, ready for a good night's sleep, and suddenly feeling an uncontrollable urge to move your legs. It's like having ants in your pants, except they're actually in your legs. These sensations can range from a mild tickle to an aching or even a creepy, crawly feeling that just won't quit. The result? Tossing, turning, and a serious case of the sleepless blues. So, why does this happen? Liver disease can cause peripheral neuropathy, a condition where the nerves outside your brain and spinal cord are damaged. When your liver isn't functioning properly, toxins can build up in your bloodstream, which can harm these peripheral nerves. This nerve damage sends jumbled signals to your brain, tricking it into thinking your legs need to move constantly to relieve the discomfort. If RLS is keeping you up at night, it's important to address it. Ensure you're getting enough nutrients, particularly those that support nerve health, like iron, magnesium, and B vitamins. Avoid alcohol as it can worsen liver function and nerve damage. Keep a regular sleep schedule and create a calming bedtime routine. Reducing stress and practicing relaxation techniques can also help. Drink plenty of water throughout the day to help your body flush out toxins and maintain overall health. Number 6. Waking up with nausea. You're in the middle of a deep sleep when suddenly you wake up with a queasy, unsettled feeling in your stomach. You might feel like you're on the verge of vomiting, and the sensation can be accompanied by a sour taste in your mouth or excessive salivation. This discomfort can make it hard to get back to sleep, leaving you tired and frustrated. One of the liver's primary roles is to filter out toxins from the blood. When the liver is not functioning properly, these toxins can accumulate and affect various bodily functions, including digestion. This buildup of toxins can lead to feelings of nausea, particularly at night. Liver disease can disrupt bile production and flow, leading to digestive issues such as indigestion or acid reflux, which can cause nausea. Additionally, liver disease can alter the balance of hormones in your body, including those that regulate digestion and appetite, further contributing to nausea. If you're waking up with nausea, here are some steps you can take to manage it. Consult your doctor, who might recommend medications or supplements to help manage nausea. Always follow their advice for safe and effective treatment. Using extra pillows to elevate your head can help prevent acid reflux, which can cause nausea during the night. Maintaining a healthy diet, avoiding late-night meals, and steering clear of foods that trigger indigestion can also help. Number 7. Frequent urination. Next up in our nocturnal adventures is finding yourself sprinting to the bathroom multiple times during the wee hours. It might be more than just an annoying disruption to your sweet dreams. It could be a signal from your body about liver issues. Liver disease can cause fluid retention and diuretic effects, leading to increased urine production, especially at night. When the liver is not functioning properly, it can lead to an imbalance in the body's fluid regulation. This often results in the accumulation of fluid in the tissues, known as edema. To compensate, your body might increase urine production to get rid of the excess fluid, causing you to wake up frequently during the night to urinate. This frequent urination can severely disrupt your sleep, leaving you feeling exhausted and irritated during the day. To manage this symptom, it's essential to adopt some practical habits. Limiting your fluid intake in the evening can reduce the likelihood of needing to urinate during the night. It's also wise to avoid beverages that can act as diuretics, such as those containing caffeine and alcohol, as they can increase urine production. By addressing the root cause and making lifestyle adjustments, you can reduce the frequency of nighttime urination, ensuring better sleep and overall well-being. Number 8. Darker urine. Waking up to find your urine is dark brown or tea-colored instead of the usual pale yellow can be alarming and may indicate an underlying health issue, such as liver disease. This change in urine color can be quite unsettling, especially if it happens frequently. Dark urine can be accompanied by other symptoms like a strong odor, fatigue, or abdominal discomfort, making it even more concerning. In the context of liver disease, dark urine is typically due to the buildup of bilirubin, a yellow compound that forms as red blood cells break down. Normally, the liver processes bilirubin, which is then excreted in bile and removed from the body through the digestive tract. When the liver is damaged, it cannot process bilirubin effectively, leading to its accumulation in the blood. This excess bilirubin is then excreted through the kidneys, causing the urine to appear dark. Liver disease can also cause dehydration, which concentrates the urine and makes it appear darker. This is particularly noticeable when you haven't had enough fluids, such as first thing in the morning. Certain medications or toxins that affect liver function can also cause dark urine. If the liver is struggling to filter these substances out, they can change the color of your urine. In severe cases, dark urine may contain blood due to complications of liver disease, such as bleeding disorders. This requires immediate medical attention. It's crucial to talk to your doctor if you notice dark urine, especially if it's persistent. They can conduct tests to determine if liver disease is the cause and suggest appropriate treatments. To help maintain liver health and prevent further complications, limit exposure to environmental toxins and chemicals that strain your liver. This includes avoiding excessive alcohol consumption and being cautious with over-the-counter pain relievers and herbal supplements. By understanding these nighttime symptoms of liver disease and taking proactive steps, such as regular checkups and open communication with your healthcare provider, you can better manage your health and overall well-being. We hope you find this information helpful. Don't forget to like and subscribe if you enjoyed the video. Eating almonds every day for a week will do this to your body. Finding a healthy snack can be tricky. It's hard to be healthy when you're consistently on the go. Grabbing something to eat that's quick and easy usually involves a ton of sugar, which can also be problematic if you're trying to lose weight. It turns out almonds could be just the food you're looking for. Keep watching to discover more health benefits of almonds, and while you're here, don't forget to subscribe to our channel for more daily tips like this and turn on notifications, so you never miss our new videos. So you hear it every day, make healthy choices. But sometimes that's easier said than done. Don't worry, your bestie is here to help. When it comes to food that's healthy, nuts and fruits are a pretty great alternative to the old faithful donut or muffin. Before we tell you some awesome health benefits of almonds, you may be surprised to learn they're technically not nuts at all. Get this, they're seeds. Almonds grow on trees, and they are classified as tree nuts. Even though they're seeds, it's a little confusing, but according to the Huffington Post, almonds are seeds of the almond fruit, which kind of looks like a peach, especially because it's fuzzy. When the almond fruit is ripe, we remove the flesh and shell, and then eat the kernel inside. And this is the almond that you know and love, which, for the sake of simplicity, we'll probably keep calling them nuts. But, you get the idea. If you don't love them already, you will after hearing these great health benefits of almonds. Reason number 1, almonds are full of benefits and are a great addition to your diet whether you're trying to lose weight or not. They're highly nutritious and are full of great stuff like healthy fats, vitamins, and minerals. According to Healthline, the USA is the world's largest producer of almonds. So, they're very popular and are really easy to add to your diet. Just one 28-gram serving of almonds contains 5 grams of fiber, 6 grams of protein, and 14 grams of fat, plus a decent amount of copper, vitamin E, vitamin B2, and phosphorus. That's all packed into a single-ounce serving. Reason number 2, did someone say antioxidants? We just did. You probably hear that word a lot when it comes to your health, and for good reason. That's the stuff that protects against damage to the molecules in your cells, which Mayo Clinic reports can help fight off heart disease, cancer, and other things you don't want happening to your body. The best way to get the most out of the almonds is to eat the ones that still have the brown layer of skin on them. That's where the most powerful antioxidants are, according to PubMed. You can easily buy blanched almonds, the ones without the skins, but if you're trying to be healthy, you'll want the brown almonds with the skins. Fruits and veggies are also a great source of antioxidants, so why not add some variety? Pass the vitamin E, please. We mentioned this a bit earlier, but we need to elaborate because this particular vitamin has some great benefits. Vitamin E is another antioxidant. Remember those? In particular, the family of fat-soluble antioxidants. And almonds are one of the best sources in the world according to nutrition data. Not only that, but several studies cited on PubMed have said that the more vitamin E you have in your diet, the more you lower your rate of heart disease, cancer, and Alzheimer's disease. Reason number 4, almonds are a popular choice for people with diabetes, and it makes sense because these nuts, or seeds, are low in carbs, but high in healthy fats, protein, and fiber. The most important trait of the almond when it comes to diabetes is they're remarkably high in magnesium. This is a mineral that helps control blood sugar, plus over 300 other bodily processes, PubMed reports. The U.S. National Library of Medicine reports several studies have shown people with type 2 diabetes are deficient in magnesium. As well as people without diabetes, also see major reduction in insulin resistance when supplementing with magnesium. All the more reason to stock up on almonds. No more overeating. Almonds are a great choice for those who are struggling with weight loss. Medical News Today reports that almonds are lower in carbohydrates and high in protein and fiber, meaning that you'll feel fuller for longer. No more snacking when you shouldn't be. The more you feel full, the less you'll feel hungry, and that means less calories consumed in a day. However, healthy eating recommends you limit your serving size if you're trying to lose weight. They do help keep you full, but they're also naturally high in calories. Try keeping your snack size to 1 ounce, or about 23 nuts. Almonds can be a great snack if you have a weight loss goal in mind. Reason number 6, almonds can help lower that bad cholesterol. As we get older, cholesterol is something that we should always keep an eye on. Bad cholesterol is a risk factor for heart disease, and adding almonds can lower that risk. But how? Well, bad cholesterol is measured in the body by something called LDL levels. The higher these levels are, the higher the risk for heart disease, and you guessed it, almonds can effectively lower those LDL levels in your blood, according to Healthline. Researchers at the University of Toronto found that a 5-ounce snack of almonds does a better job at lowering these LDL levels than a whole wheat muffin. All it takes is eating 1 or 2 handfuls of almonds per day. Reason number 7, digestive health benefits. Not only do almonds taste good, but they are high in fiber, which gives them prebiotic properties, which is great for your digestive health overall. Prebiotics promote good bacteria in your stomach and will help you maintain a healthy balance. While research is promising, when it comes to prebiotics, more research is needed. You can still maintain a healthy digestive system with a normal healthy diet, but so far it seems adding almonds doesn't hurt. Reason number 8, to cook them or not to cook them? That is the question. You can get almonds in all sorts of ways. Raw, roasted, sliced, candied? You probably guessed it, but unfortunately, Candies are not a healthy option and should be avoided if you're trying to stick to a healthy diet, although they are pretty yummy when added to sweets. Just saying. So which is better? Raw or roasted? Well, that's a tough one. Healthy eating reports they both pack a high dose of nutrients and minerals, although raw does seem to have more naturally occurring beneficial fats, which can be lost when you're roasting them. So raw is probably the best way to get the most out of these babies, but there's no reason you can't switch it up and roast them once in a while too. Reason number 9, they can help prevent gallstones. Hopefully you've never had gallstones in your life because they hurt. Gallstones are formed in the gallbladder. The stones are solid particles ranging in size from a grain of sand to a golf ball. They can form when we neglect our healthy diet by eating high-fat, high-cholesterol meals. Ahem, step away from the French fries. There's really no cure for gallstones, and in some cases surgery is needed to get rid of them. However, you can stick to a healthy diet and reduce your risk of these pesky things from forming. WH Foods talks about a study done over 20 years and involved over 80,000 women. In this study, they found women who eat 1 ounce of nuts, almonds, peanuts, or peanut butter each week have a 25% lower risk of developing gallstones. Another great reason to grab a handful of almonds for your afternoon pick-me-up. Now that you know all the benefits almonds have to offer, we have some inspiration on how you can incorporate them into your diet. Here's a few quick snack ideas to help you stick to that healthy diet and enjoy all the benefits of almonds. If you're a fan of yogurt, almonds are a great addition. Try chopping some almonds and adding some dried fruit to boost the healthy impact. Sliced almonds can also be added to any veggie sauté or curry for added texture and fiber. If you're someone that's on the go, smoothies are a great breakfast alternative so you don't miss a meal. Adding almond butter to any shake will give your protein count a boost and add some great flavor. Craving something crunchy? Almonds and apple slices are a match made in heaven and will satisfy just as much, if not more, than that unhealthy bag of chips. And that's it. What did you think of our list? Did we miss one of the major benefits of almonds? Which one of our snack ideas did you like the best? Are you someone who's loved almonds all along and have some great go-to snack ideas? Why not share them with the world, so we can all reap the benefits in the comments below. Thanks for watching. Alcohol and liver health. How much is risky? We are imperative to discuss the implications of alcohol consumption on liver health. A study indicated that merely 21 binge drinking episodes can initiate early-stage liver disease. To clarify, binge drinking refers to consuming over 5 standard drinks in a 2-hour period. A standard drink in this context contains approximately 0.6 ounces of pure alcohol. This amount is typically found in a standard can of beer, 8 ounces of malt liquor, 5 ounces of wine, or a 1.5-ounce shot of distilled spirits. Therefore, indulging in 521 separate occasions could precipitate the onset of early-stage liver disease. Furthermore, even a single binge drinking episode can elevate liver enzymes, indicating stress or damage to the liver. When alcohol is consumed, about 25% is absorbed directly into the bloodstream from the stomach, while the remainder is absorbed through the small intestine. The absorbed alcohol then circulates to the liver. The liver's role is to metabolize and detoxify this substance. However, the initial stage of alcohol breakdown is particularly harmful to liver cells. This stage can cause inflammation and, over time, lead to the development of scar tissue in the liver, a condition known as cirrhosis. Understanding these risks is crucial for maintaining liver health and preventing alcohol-related liver diseases. from it's essential to understand the metabolic process of alcohol in the liver and its long-term effects. Remember to subscribe to our channel to stay updated with our latest videos. Typically, when an individual consumes one alcoholic drink, it takes about an hour for the liver's enzymes to metabolize it into less harmful substances. However, persistent alcohol consumption can impair this critical enzyme network, leading to an accumulation of toxic substances in the liver and other organs like the pancreas. The initial consequence of regular alcohol intake is the accumulation of fat in the liver. This fatty buildup can trigger inflammation, potentially leading to the formation of scar tissue in the liver. Additionally, the fat in the liver can contribute to insulin resistance, further exacerbating inflammation. This creates a vicious cycle of liver damage. Regarding liver inflammation, medically termed as hepatitis, it typically begins within 5 years of consistent heavy drinking. It's crucial to recognize these risks and understand that chronic alcohol consumption can lead to serious liver complications. Emphasizing the importance of moderation and awareness in alcohol consumption for maintaining liver health. The progression of liver diseases like cirrhosis, which typically develops over a span of 5 to 10 years or more. This condition is a result of prolonged inflammation in the liver, leading the body to repair the damage with scar tissue, often involving the immune system. Intriguingly, during this period, symptoms may not be pronounced. Individuals might experience fatigue or notice an enlarged abdomen, although it's not always a definitive indicator. Skinny fat is another condition where fat accumulates around the organs without noticeable weight gain. A protruding belly, particularly in the context of liver disease, often indicates a fatty liver. Ascites, another serious condition, involves fluid accumulation in the abdominal cavity due to severe liver damage. This indicates an advanced stage of liver disease. As the disease progresses, more symptoms emerge, such as arthritis and itching, particularly on the soles of the feet. Jaundice, characterized by yellowing of the eyes and skin, may also occur. Hormonal imbalances, leading to increased estrogen and decreased testosterone levels, can result in changes like the development of gynecomastia. Patients often feel lethargic, may suffer from bad breath, and experience muscle loss. Despite these manifestations, an individual might otherwise feel normal, underscoring the insidious nature of liver disease and the importance of early detection and intervention. There are additional factors influencing the impact of alcohol on your liver. Firstly, the concentration of alcohol consumed plays a significant role. Higher alcohol content in beverages can exacerbate liver damage compared to more diluted drinks. Additionally, carbonation in alcoholic beverages is believed to intensify their adverse effects on the liver. The presence of food while consuming alcohol also matters. Food can act as a buffer, mitigating some of the harmful impacts of alcohol on the liver. However, chronic alcohol consumption leads to significant oxidative stress in the liver, characterized by an increase in free radical damage. Over time, the liver's ability to counteract these harmful effects diminishes. This progressive decline in liver function hampers the body's ability to detoxify substances and affects digestion. Consequently, there is an increased risk of DNA damage and even liver cancer. Alarmingly, the age of onset for severe liver conditions like cirrhosis is decreasing. It used to be diagnosed primarily in individuals in their 40s, 50s, or 60s. However, we are now witnessing cases of cirrhosis in much younger individuals, including those in their mid-20s. This trend underscores the urgent need for increased awareness and prevention strategies regarding alcohol consumption and liver health. Indeed, from 1999 to 2016, cirrhosis-related deaths have escalated by 65%, indicating an alarming trend of increased alcohol consumption and its detrimental effects among younger populations. It's crucial to recognize that liver damage isn't solely caused by alcohol. The consumption of sugar, particularly in the form of high fructose corn syrup, can have effects on the liver similar to those of alcohol. Therefore, abstaining from alcohol doesn't necessarily safeguard against liver issues. This leads to the condition known as non-alcoholic liver disease. Additionally, numerous medications contribute significantly to liver damage. It's evident that alcohol, sugar, certain medications, and viral infections are among the top contributors to liver deterioration. While it might seem contradictory, maintaining a healthy diet is vital for those who consume substantial amounts of alcohol in an attempt to mitigate the liver damage incurred. However, it's often observed that individuals with high alcohol intake also tend to follow a diet high in sugar, which compounds the problem. The remarkable aspect of liver health is that the liver is the only organ capable of complete regeneration, provided that the damaging factors are eliminated. Impressively, in cases of fatty liver, up to 50% of the fat accumulation can be reduced within just 2 weeks by avoiding the causative agents. Nevertheless, it's crucial to understand that there's a threshold beyond which the damage becomes irreversible, particularly when excessive scar tissue is formed. It's vital to address liver health before reaching this point of no return. For those seeking to reverse liver damage and improve their liver health, gaining knowledge on this topic is essential. To learn more about this topic, please like the video and subscribe to my Bestie channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Top 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease. Some skin changes are specific to kidney disease, whereas other changes in the skin are nonspecific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed, and a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage in the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. Dialysis. Long-term dialysis patients are more at risk. Obesity, higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful, pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific, as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50 to 80% of individuals on dialysis, and here are a few common causes. 1. Poor hydration. 2. Decreased sweat gland activity. 3. High levels of vitamin A. 4. Long-term use of diuretics. 5. Xerosis. Usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with xerosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions, one of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, hair, mucosal, and nail disorders were found in 45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues, including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. Notes 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms? As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, Pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. For you need to make important changes to manage kidney damage. These changes include 1. Diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk. due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. See you again. Stay informed. Stay healthy. Welcome back to my channel. Since its discovery more than 5,000 years ago, garlic has been a culinary chameleon. The medicinal properties of garlic were highly regarded in ancient times. However, its benefits extend beyond its robust flavor and aromatic allure. Modern research has unveiled a trove of health benefits, ranging from combating illnesses to protecting the heart, making garlic a powerhouse in the realm of natural health remedies. Through today's video, we will be revealing 12 fascinating benefits of garlic. Without any further delay, let's get started. Number 1. Boosts immune function. Garlic, a widely used food ingredient, is well known for its immune-boosting properties. The key component contributing to this benefit is allicin, a compound that forms when garlic cloves are crushed or chopped. Allicin possesses strong antimicrobial and antiviral properties which play a significant role in enhancing the immune system's ability to fight off infections. Even one study found that people who took garlic every day for 3 months had fewer colds. Moreover, garlic is rich in antioxidants, substances that may prevent or delay some types of cell damage. Antioxidants neutralize free radicals, which are unstable molecules that may damage cells, including immune cells. Thus, garlic helps maintain their functional integrity, ensuring they may respond effectively to infections and other immune challenges. Number 2. Reduces blood pressure. High blood pressure always takes a toll on our health. You may wonder why allicin, a highly recognized compound, has shown potential for reducing blood pressure effectively. This sulfur compound is thought to increase the production of hydrogen sulfide, a gasotransmitter that moves through blood vessels and improves the control of endothelial nitric oxide. It is known to induce smooth muscle cell relaxation and reduce arterial stiffness, leading to lower blood pressure. Additionally, allicin may aid in the reduction of angiotensin II, a hormone that increases blood pressure by narrowing blood vessels. A meta-analysis including 20 clinical trials suggested garlic to be superior to placebo in lowering blood pressure in hypertensive patients, on average by 8 to 9 points in systolic blood pressure and 6 to 7 millimeters of mercury in diastolic blood pressure. But how many cloves of garlic should you consume to get this benefit? According to research, aged garlic is extracted at 1,500 milligrams per day, which is roughly equivalent to 2 to 5 garlic cloves daily. Number 3. lowers cholesterol levels. There are few issues that may put our hearts at risk, and elevated cholesterol certainly tops that list. However, a common staple like garlic may contribute to lowering this level with the help of its beneficial compounds like allicin, along with other sulfur-containing compounds, such as agein and alliin. These compounds appear to help inhibit the activity of certain enzymes in the liver responsible for synthesizing lipids, including cholesterol. This leads to a reduction in the overall production of cholesterol in the body. They may also have a positive effect on lipid peroxidation, which refers to the oxidative degradation of lipids, which may contribute to increased levels of bad LDL cholesterol and the formation of plaques in the arteries. The antioxidants in garlic help prevent this process, thereby aiding in the maintenance of healthier cholesterol levels. Moreover, garlic contains compounds that may inhibit platelet aggregation, which is known for contributing to the formation of blood clots and increasing the risk of heart attacks and strokes. Garlic's antiplatelet properties help reduce this risk, making it beneficial for cardiovascular health. According to the findings, using garlic powder rather than raw garlic for 16 weeks in hyperlipidemic patients showed a significant decrease in serum cholesterol and serum triglyceride. About 1/3 of these studies showed a significant 11 to 26% reduction in bad cholesterol levels. Number 4. Antioxidant properties. Garlic also possesses multiple antioxidant properties due to various phytochemicals, such as disulfide and SLL-cysteine, present in it. These antioxidants contribute to the neutralization of free radicals, thereby protecting cells from oxidative damage. Furthermore, garlic contains other antioxidants like flavonoids and selenium, which enhance its oxidative stress-reducing effects. 7 studies with 317 people investigated how garlic supplements affect the body's ability to handle oxidative stress, which may harm cells. The study showed that taking garlic supplements greatly increased the body's total antioxidant capacity by 11 millimoles per liter and decreased malondialdehyde levels, which is a sign of oxidative stress, by about 2 millimoles per liter. This kept cells from getting damaged. Number 5. Improves bone health. You might be surprised, but sulfur compounds like diallyl disulfide and others in garlic are thought to influence bone health. Additionally, it contains phytoestrogens, plant-based compounds that may mimic the hormone estrogen in the body. Estrogen is known to play a critical role in maintaining bone density, especially in postmenopausal women, who are at a higher risk of osteoporosis due to decreased estrogen levels. In addition to that, garlic's anti-inflammatory and antioxidant properties also contribute to bone health. Chronic inflammation and oxidative stress are factors that may lead to bone weakening and loss. The antioxidants in garlic help neutralize free radicals, protecting bone cells from damage. In a study with 80 postmenopausal women who were overweight or obese, researchers tested if garlic could help with knee osteoarthritis. After 12 weeks, the women who took 1,000 milligrams of garlic daily had a significant drop in resistance levels, a marker linked to inflammation. The garlic group ended up having less pain compared to the placebo group. This suggests that garlic might help reduce pain in people with mild to moderate knee osteoarthritis. Number 6. Enhances brain health. Do you know that antioxidants are highly essential to protecting brain health? Garlic contains antioxidants like allicin, which help neutralize harmful free radicals in the brain. Free radicals may damage brain cells and contribute to cognitive decline. By reducing oxidative stress, garlic may help protect brain cells. As opposed to most medicines used to treat depression, garlic extracts work on multiple biochemical locations in the brain, which is called a multi-target strategy. This is because the antioxidant and anti-inflammatory properties of allicin in garlic extracts are good for the brain, protecting against diseases such as Alzheimer's. Number 7. Detoxifies heavy metals. When you consume garlic, its sulfur compounds, like allicin, into the bloodstream. These compounds have a natural affinity for heavy metals, meaning they tend to attract and bind to metals like lead, cadmium, and mercury present in the body. Once the sulfur compounds from garlic bind to the heavy metals, they form a complex. This complex is a new chemical structure that is more readily processed by the body compared to heavy metals alone. The body is more efficient at removing these complexes than the heavy metals themselves. The bound heavy metals are then excreted from the body through natural processes, primarily via the urine and feces. In a study with 117 workers from a car battery factory, researchers looked at how well garlic could treat lead poisoning. The results were pretty impressive. The group that took garlic saw significant improvements in several symptoms like irritability, headaches, reflexes, and blood pressure, with no significant side effects. This suggests that garlic is not only effective, but also safer for treating mild to moderate lead poisoning. Number 8. Improves digestive health. Garlic acts as a prebiotic, which means it feeds the good bacteria in the gut. It contains inulin, a type of dietary fiber, and fructooligosaccharides. These compounds promote the growth of beneficial gut bacteria, like bifidobacteria and lactobacilli, which are essential for a healthy gut microbiome. Studies have shown that aged garlic extract contains major water-soluble organosulfur compounds essential for the maintenance of immune system homeostasis through modulation of cytokine secretion, promotion of phagocytosis, and activation of macrophages. They may help control harmful bacteria and yeasts in the gut, reducing the risk of gut infections and imbalances. Thus, aged garlic extract helps reduce inflammation in the gut, which is important for conditions like inflammatory bowel disease. Number 9. Skin health. Skin health. Acne is often caused or exacerbated by the overgrowth of certain bacteria on the skin, such as Propionibacterium acnes. Allicin found in garlic when applied to the skin or consumed in the diet may help control these bacterial populations. It works by attacking the bacteria, directly inhibiting their growth and reducing their ability to cause inflammation and infection. This action of allicin may lead to a noticeable reduction in acne and may help prevent future breakouts. Studies have shown that garlic extract may protect against skin cancer caused by too much sunlight. It also helps skin cells called fibroblasts grow better, which could prevent aging of the skin. Besides, garlic extract may influence the immune system in a way that might help treat psoriasis, a skin condition. It could be especially useful when used with other treatments like topical steroids and moisturizers, offering a new way to help people with psoriasis. Number 10. Regulate blood sugar. Do you suffer from high blood sugar? Well, diabetes may be a troublesome condition that hinders normal living. However, garlic contains compounds that help improve the body's response to insulin. Insulin is a crucial hormone that helps regulate blood sugar levels by facilitating the uptake of glucose into cells. When the body is more sensitive to insulin, it may use this hormone more effectively. This improved insulin sensitivity means that the body is better at lowering high blood sugar levels, as cells may more readily absorb glucose from the blood under insulin's guidance. There are 9 studies with 768 diabetic patients to look into this effect. participants consumed 5 to 150 milligrams of allicin through garlic daily. The results showed that garlic significantly reduced fasting blood glucose levels. Moreover, garlic also notably decreased levels of fructosamine and glycated hemoglobin, which are important indicators of blood sugar control. Number 11. Improves iron metabolism. Iron is stored in the liver, spleen, and bone marrow. Garlic contains compounds like daily sulfides, which may stimulate the production of a protein called ferroportin. Enhancing ferroportin production means that it may help mobilize stored iron, making it available for essential bodily functions like oxygen transport and red blood cells. By promoting the absorption and mobilization of iron, garlic may contribute to improved iron status, which is particularly beneficial for individuals at risk of iron deficiency. This improved iron status may lead to better oxygenation of the body, increased energy levels, and overall better health. Number 12. Hair health. Earlier in the video, we told you that garlic may improve blood flow, which is crucial for hair growth. This increased blood flow means that more nutrients and oxygen are delivered to the hair follicles, which may promote hair growth and health. The nutrients in garlic work at the hair shaft level, reinforcing the hair and reducing breakage. This means that hair is less likely to break or split, which is important for maintaining hair thickness and overall hair health. A healthy scalp environment is essential for the growth of strong and healthy hair by fighting off harmful bacteria and fungi on the scalp. Garlic helps maintain scalp health, preventing conditions that could hinder hair growth or cause hair loss. In a study focused on hair loss treatment, about 20 patients with alopecia areata applied garlic gel twice daily for 3 months. 95% of those participants showed good responses. This suggests that garlic gel could be a helpful additional treatment for this type of hair loss. What are the potential dangers of consuming garlic? While garlic is widely recognized for its health benefits, it's important to be aware of its potential risks, especially when consumed in large quantities or in certain health conditions. If you like this video, let us know in the comments section below. Subscribe to our channel for more videos like this. Welcome back to my channel. Life is like an onion. It's stinky and you cry sometimes. That's how the saying goes, right? Well, you may be surprised to learn that onions are pretty complex. Although they may have a bad reputation, they're a vegetable, so that means they're packed full of healthy things your body needs. Today, we're going to look at some impressive benefits of onions, how to pick the perfect onion, and how to store your new favorite veggie, so you don't waste money. Before you discover all the secrets of onions, make sure you unlock all the other benefits we have to offer by subscribing to our channel and turning on notifications so you never miss our new videos. When you think of foods that are good for your health, what comes to mind? Kale? An apple? Or maybe an orange? Well, it's time to shine the spotlight on the underrated vegetable known as the onion. Not only are they packed full of vitamins that give your body a boost, they also make food taste delicious. But that's just a bonus. Onions have actually been used as food for thousands of years, dating all the way back to ancient Egypt. Keep watching as we peel back the layers on why you should be adding more onion to your daily routine. Reason number 1, they pack a punch. Not just in how they taste, but in the way they can help your body too. Just one onion can give you a considerable dose of vitamins, minerals, and fiber. And as we know, fiber is great for keeping you regular. Not to mention, if you're looking to lose weight, these vegetables are super low in calories. According to the USDA food composition databases, one medium onion has just 44 calories, but delivers a considerable dose of those important vitamins, minerals, and that fiber we mentioned before. Reason number 2, your heart loves onions. Let the love affair begin because onions contain all kinds of benefits when it comes to your heart. Onions can even lower your risk of heart disease. The U.S. National Library of Medicine says onions have the power to lower cholesterol levels and a decrease in heart disease risk factors such as high blood pressure. Maybe you've heard that red wine also contains heart protective qualities. But according to Medical Daily, eating an onion, now the question is, do onions and wine go together? Reason number 3, when it comes to antioxidants, onions are one of the best. The Plant Kinderheim Research Center says onions contain over 25 different types of varieties of antioxidants, which help fight against diseases like diabetes, heart disease, and cancer. Reason number 4, onions are up for a fight. Researchers at the National Center for Nutrition for Biotechnology Information say veggies of the allium genus, like garlic and onions, have been linked to a lower risk of certain cancers, like stomach and colorectal. Not to mention, the U.S. National Library of Medicine lists onions as one of the vegetables that can possibly put the brakes on tumor growth. If that doesn't count as a wonder veggie, then we don't know what does. Reason number 5, if you're diabetic, listen up, because our friend the onion can help control your blood sugar. Specifically, fresh red onion. In a study cited by PubMed Central, with 42 people who have type 2 diabetes, the results show eating red onion reduced fasting blood sugar levels by about 40 milligrams per deciliter after just one meal. So next time you're at the grocery store, mix it up and grab some red onion to add to your next meal. Reason number 6, dairy takes most of the credit for this one, but onion juice actually helps support strong bones, too. The U.S. National Library of Medicine reports, onion juice can improve bone density, which can help prevent osteoporosis, a disease that causes bones to become weak and even break from things like falling or even sneezing. Reason number 7, not convinced onions are super vegetables yet? Well, a study done by the School of Chemical Engineering, Yongam University in Korea, says onions can even help fight against dangerous bacteria such as E. coli. It's even believed that onion extract can curb the growth of bacteria that is a major public concern in developing parts of the world. Reason number 8, they're good for your gut. Move over yogurt because onions are here for your belly too. Onions are rich with fiber and probiotics, which are those good bacteria your gut needs to benefit digestive health and improve immune function, according to the U.S. National Library of Medicine. There's more than one way to cook an onion, but be warned, dear viewer. There have been reports that eating raw onion can cause irritation in the belly, and some people find it hard to digest. We recommend starting with cooked onions, and working your way up from there. Reason number 9, onions can help get rid of that nasty cold. Ever hear of onion honey syrup? Well, according to Style Craze, adding this honey-onion mixture to your routine can boost your health. Just cook some onion slices with a half cup of honey until the onions turn translucent and soft, and there you have it. A spoonful of this every 3 to 4 hours can help you feel better in no time. Reason number 10, onions may not smell the best, but they can actually help with your breathing, especially when it comes to those with asthma. Onions contain something called quercetin, an antioxidant that can help reduce histamine, which is what makes you sneeze or itch. Onions can also promote an anti-inflammatory response in the body, according to Medical Daily. Reason number 11, say cheese. Hang on. Have we switched to cheese? Don't get confused. We're still talking about onions. When it comes to your smile, raw onions can improve those pearly whites. Now, this one is not for the faint of heart. If you want to boost your oral health, the Natural Society recommends chewing on raw onion for about 2 to 3 minutes in order to help strengthen teeth and get rid of bacteria that can cause tooth decay. You know what they say, an onion a day keeps the doctor away. Reason number 12, onions can help keep your immune system strong. And Money, a dietitian based in Washington, D.C., says the polyphenol in onions act as antioxidants, protecting the body against free radicals. Eliminating free radicals can help encourage a strong immune system. Your immune system is basically your body's defense against potentially harmful viruses and diseases. So, given the chance, wouldn't you want to help strengthen it? Reason number 13, onions have the power to heal. The folks at Care2 say people have been using onions for their healing properties for centuries. And we're just hearing about this now. They go on to say the main benefits include reducing inflammation and healing infections. For example, let's say you get stung by a honeybee. That hurts. But the pain won't last for long if you have an onion close by. Just apply some onion juice to the sting for instant relief from any pain or burning sensations. Reason number 14, onions are super easy to add to your diet. If you're trying to lose weight, try them in your favorite chili, or spice up taco night with some homemade guacamole and fresh salsa. You'll be surprised with the many different ways you can incorporate onions into some of your favorite recipes. Now that you know all the ways in which an onion cares for you, we figured you should know all the ways to care for your onions. When it comes to choosing the perfect onion, you want one that is clean, hard, and fresh, and has dry, smooth skin. There are many types of onion, but if you're looking for one that's available throughout the year, regular yellow onions are probably your best bet. Once you get your onions home, do not put them in the fridge. We know it's weird, right? According to Healthline, whole onions absorb moisture very well. And putting them in the fridge could make them mushy or spoil faster. However, peeled or sliced onions can be stored in the fridge for up to 2 weeks. Whole onions are best kept in a cool, dark, and well-ventilated place, like your pantry, basement, or garage. Before we wrap up, there is one thing we want you to know about our friend the onion. It does have a reputation for being a little. The main negative aspect of cooking with onions is indeed the smell. It can be a real problem. But fear not, dear viewer, we've got the remedy for the onion's revenge. After chopping onions, try rinsing the hands with cold water, rubbing them with salt, rinsing again, and then washing with soap and warm water. To remove the smell from your breath, eat a few pieces of parsley or an apple to conceal the odor. And that's it. So how impressive was this list? Are you going to start adding onion juice to your daily routine? Let us know what you thought of this video. And if you have some favorite onion-inspired dishes, make sure to share them in the comments below. Enjoyed this video? Hit the like button and share with your friends. Also subscribe to our channel for more videos like this. Thanks for watching. Hello there, lovely viewers, and welcome back to our channel. Today, we've got a topic that many of you have been asking about, a natural solution to one of the most uncomfortable issues, acid reflux. Acid reflux can really disrupt your daily life. That burning sensation, the regurgitation of stomach acid, and that constant discomfort, it's no fun at all. But before we dive into the solution, let's understand what causes acid reflux. It happens when the lower esophageal sphincter doesn't close properly, allowing stomach acid to flow back into your esophagus, causing that painful burning sensation. So, what's the solution? Well, we've got the answer for you today. We're going to talk about 5 essential vitamins that can help you naturally combat acid reflux. 1. Beta-HCl, also known as trimethylglycine or TMG, is like a helpful sidekick for your stomach. It's naturally found in foods like carrots, spinach, and wheat. Now, when you eat, your stomach normally churns out hydrochloric acid, HCl, to break down that meal and keep nasty bacteria at bay. But for some folks dealing with GERD, gastroesophageal reflux disease, their stomachs might not make enough HCl or struggle to do so efficiently. Here's where Beta-HCl steps in as the hero. It's a supplement that gives your stomach an extra boost of HCl. This helps supercharge the digestion process and eases those GERD symptoms. Not only does it tackle acid reflux, but it also makes sure your body absorbs nutrients like a champ, giving your overall digestive health a boost. But remember, always consult a healthcare pro before using Beta-HCl. They'll make sure you get the right dose and a personalized plan to fit your specific health needs. Dyeing it with Beta-HCl or any medication is a no-no. 2. Probiotics. Those little helpers containing friendly bacteria are like your digestive system's best friends when it comes to keeping acid reflux at bay. These beneficial microbes, such as lactobacillus and bifidobacterium, can be naturally found in foods like yogurt or kefir. So, how do probiotics do their thing? Well, they work by restoring the balance in your gut, which is super important for a healthy digestive system. When that balance gets out of whack, that's when acid reflux can become a problem. Probiotics step up to the plate by giving your digestive system some much-needed support. They help calm down your stomach, reducing those not-so-fun symptoms like too much saliva, feeling queasy, or being overly full. What's more, some probiotics act like little bodyguards for your stomach and esophagus, creating a protective barrier that shields them from the harsh effects of stomach acid. The real magic of probiotics is seen in how they ease those GERD symptoms. They can make heartburn, bloating, and indigestion feel a whole lot better. Plus, they boost your overall immune system by keeping the balance of bacteria in your stomach and intestines in check. And guess what? Compared to some of those acid-blocking meds, probiotics usually come with fewer side effects and are a safer choice. 3. Vitamin B12. Vitamin B12 is like a superhero nutrient for our digestive system and overall health. So, where does this superhero vitamin come from? Well, it's part of the essential B vitamin family, known as cobalamin. You can find it hanging out in foods like meat, fish, dairy goodies, eggs, and even some B12 fortified options. The cool part about vitamin B12 and the acid reflux story is how it indirectly helps out. It's like a behind-the-scenes superstar. First off, it's a protector of the stomach lining, creating a strong barrier against the harsh effects of stomach acid. This shield is what keeps acid reflux from going haywire. Plus, vitamin B12 is essential for the digestion party, helping out with enzymes and giving energy to our digestive cells. And here's a neat tidbit: research suggests that keeping a good vitamin B12 level can toughen up your digestive system. But here's the deal: vitamin B12 isn't the direct solution to acid reflux. To tackle that, you'll need a team effort, usually involving dietary tweaks, special meds, or sometimes even surgery, all of which should get the green light from a healthcare buddy. But hey, keeping your vitamin B12 levels in check is a win-win for your overall digestive health and your overall well-being, so it's worth paying attention to this unsung hero. 4. Apple cider vinegar. Apple cider vinegar is like the all-natural champ made from fermenting apples or apple juice. People have been using it for ages to deal with different health issues, including the pesky acid reflux. Let's dive into where it comes from and how it helps with this acid reflux thing. So, where does apple cider vinegar come from? Well, it's born from the process of fermenting apples or their juice, and it's got quite a history as a remedy. Now, the cool part about apple cider vinegar and the acid reflux story is its ability to play around with stomach pH levels. Itomic, which can help ease that burning feeling and general discomfort from acid reflux. Some folks even swear by taking a little apple cider vinegar before meals to give their digestion a boost, potentially reducing those pesky GERD symptoms. But, here's the important bit, don't go overboard with the apple cider vinegar. Too much of a good thing can lead to problems like tooth enamel damage and stomach irritation. 5. Ginger capsules. Made from the natural root of the ginger plant, have a rich history of use in traditional medicine and are often considered a potential remedy for acid reflux. These capsules make it super easy to enjoy the benefits. One of the big perks of ginger capsules is their quick soothing power. Ginger has this amazing ability to calm down the discomfort of acid reflux, including that pesky burning feeling, indigestion, and even nausea. What's more, ginger packs a punch when it comes to fighting inflammation and harmful bacteria, thanks to its special compounds. This helps dial down inflammation in your stomach and esophagus, which can play a part in preventing acid reflux. And here's another neat trick. Ginger capsules are known to give your digestion a boost by revving up the production of digestive enzymes. This means your digestive system works more efficiently. GERD symptoms. In conclusion, you don't have to rely solely on medication to alleviate acid reflux. Mother Nature has provided us with some amazing tools in the form of these 5 essential vitamins. Stay tuned as we embark on this journey to explore how they can help you live a more comfortable and reflux-free life. Thank you for joining us today, and we'll see you in our next video. Until then, take care and stay healthy. Welcome to Health Bestie on YouTube. A quiet yet formidable health crisis is unfolding globally, affecting millions. Non-alcoholic fatty liver disease, or NAFLD, is a growing concern, particularly prevalent in the United States where it affects between 30 to 40% of the population. This condition, also simply known as fatty liver disease, is linked to significant health complications including liver failure, diabetes, heart attacks, and cancer, impacting 1 in 5 individuals worldwide. NAFLD is primarily associated with dietary factors such as high fructose intake, consumption of vegetable seed oils, and overall excessive caloric consumption. The primary issue at the heart of NAFLD is the excessive accumulation of fat in the liver, so much so that it hampers the liver's ability to function efficiently. A liver is deemed fatty when more than 5% of its composition is fat, turning it into a reservoir for toxins. The insidious aspect of fatty liver is its silent progression. Often, there are no symptoms until the disease is well advanced. When symptoms do manifest, they may include fatigue, pain in the upper right abdomen, itchy skin, and nausea, amongst others. Research indicates that about 20% of non-alcoholic fatty liver disease, NAFLD, cases progress to a more severe stage known as non-alcoholic steatohepatitis, NASH. In this advanced phase, inflammation and fat accumulation begin to damage liver cells seriously, potentially leading to scarring, fibrosis, and ultimately cirrhosis, permanent and debilitating liver damage. Once it transitions to NASH, the liver's functionality is severely compromised. NASH is not only a serious health concern but also life-threatening, increasing the risk of progressing to liver cancer. This type of cancer is particularly aggressive and challenging to treat, highlighting the critical nature of early intervention and management. Fortunately, there's a silver lining. The impacts of NAFLD can often be reversed through targeted dietary and lifestyle modifications. In today's discussion, we will explore a two-stage process designed to naturally detoxify the liver, emphasizing the power of proactive health management to combat this silent epidemic. Stage 1 of detoxifying a fatty liver cleanup. The first critical step in reversing fatty liver involves a comprehensive cleanup of both your diet and environment. This stage is foundational, focusing on eliminating substances that exacerbate fatty liver while implementing healthier lifestyle choices. Dietary changes begin by drastically reducing your intake of refined carbohydrates. This includes cutting out added sugars, especially high fructose corn syrup, HFCS, and avoiding sugary beverages. HFCS, commonly found in many processed foods and drinks, not only prompts significant fat production in the liver but also contributes to a host of other health issues including high blood sugar, increased inflammation, and insulin resistance. These conditions are precursors to more serious complications such as diabetes and obesity. Eliminating refined grains such as bread, pasta, and snacks, as well as desserts, should also be avoided. These foods quickly convert to glucose in the body, overloading the liver and prompting it to convert this excess sugar into fat at an accelerated rate. Visceral fat, as fat continues to build up not just in the liver but also around other organs, it leads to an increase in LDL cholesterol and systemic inflammation. This type of visceral fat is particularly dangerous as it significantly elevates the risk of cardiovascular diseases, including heart attacks. Before we get into stage 2, here's a quick rundown of what your liver does. It removes toxins from the blood, processes nutrients, regulates blood sugar, and produces bile for digestion. Continuing with the detoxification process of a fatty liver, it's crucial to address the role of dietary fats and environmental toxins. In this second phase of the cleanup strategy, further essential adjustments are needed to foster liver health and overall well-being. Eliminate harmful fats. First and foremost, steer clear of vegetable seed oils such as soybean, cottonseed, corn, canola, sunflower, safflower, and peanut oil. These oils are often chemically processed, contributing to inflammation not only in the liver but also throughout the digestive system. Learn linoleic acid, a common component in these oils, is linked to increased liver enzymes and the development of fatty liver. Reduce processed food intake. Processed foods are typically reassembled with unhealthy additives such as added sugars, salts, vegetable oils, fillers, and various chemicals. These components can significantly strain liver function. Choose organic to minimize exposure to pesticides and genetically modified organisms. GMOs opt for organic foods when possible or purchase directly from local farmers. This practice helps reduce the intake of harmful substances that can aggravate liver conditions. Limit alcohol and toxins. Alcohol is a well-known irritant to the liver and reducing its consumption is vital. Additionally, be cautious of the toxins present in water, air, and personal care products. These toxins can overload the liver and facilitate the progression of non-alcoholic fatty liver disease, NAFLD. Engaging in physical activity, regular exercise, and intermittent fasting are effective methods to burn off excess glycogen stored in the liver. When liver glycogen is depleted, It reduces the likelihood of carbohydrates and sugars converting into fat stored in the liver, helping to decrease overall fat accumulation, hydration, and sleep. Finally, maintain adequate hydration and ensure quality sleep. Both are essential for supporting the liver's natural detoxification processes and overall health. Before we dive into stage 2 of our liver detoxification journey, let's first appreciate the crucial roles your liver plays. This vital organ is not only responsible for removing toxins from your blood but also processes nutrients, regulates blood sugar levels, and produces bile, which is essential for digestion. Additionally, the liver synthesizes glutathione, known as the body's master antioxidant. Glutathione plays a key role in combating pollutants, pathogens, and carcinogens that we encounter daily. If you're finding this information helpful, please make sure to like, share, and subscribe. Don't forget to hit the notifications bell so you never miss out on our health insights. Now, moving on to stage 2, which we call reset, we focus on integrating specific foods and supplements that help rejuvenate and restore liver health. This next phase is critical for reinforcing the liver's natural detox capabilities and enhancing its function after the initial cleanup stage. Number 1. Extra fiber and probiotics. Incorporating more fiber and probiotics into your diet is essential for maintaining healthy blood sugar levels and supporting liver health. Fiber, particularly soluble fiber, is a type of complex carbohydrate that does not cause spikes in blood sugar. It aids in keeping you fuller for longer, which helps in managing weight by preventing overeating. Soluble fiber also plays a crucial role in maintaining regular bowel movements, facilitating the rapid elimination of toxins from the body. Soluble fiber works by dissolving in water to form a gel-like substance that nourishes and supports the beneficial bacteria, probiotics, in your gut. This relationship is vital because about 70% of the blood that the liver filters comes from the intestines. Boosting your gut's beneficial bacteria can significantly reduce liver inflammation and decrease the risk of developing fatty liver. Excellent sources of soluble fiber include garlic, chicory root, apples, barley, beans, carrots, citrus fruits, oats, and peas. While most plant foods contain both soluble and insoluble fiber, they typically have higher concentrations of one type. Insoluble fiber, which helps form stool by absorbing fluids and adhering to other materials, can be found in foods like mushrooms, beans, nuts, vegetables, and berries. To increase your intake of probiotics, consider adding fermented foods to your diet, such as sauerkraut, kimchi, kefir, natto, and certain cheeses like aged cheddar and Gouda. These foods help enhance gut health, which in turn supports liver function and overall well-being. Number 2. Cruciferous and sulfur-rich vegetables. Incorporating cruciferous and sulfur-rich vegetables into your diet is a powerhouse strategy for enhancing liver health. These vegetables are celebrated for their ability to boost the liver's detoxification processes and shield it from damage. These include broccoli, Brussels sprouts, cabbage, kale, bok choy, Swiss chard, cauliflower, watercress, turnips, and radishes. A notable compound found in broccoli sprouts, called sulforaphane, has been shown to significantly improve liver function and reduce oxidative stress. Animal studies suggest that sulforaphane can even prevent liver failure by increasing the activity of detoxification enzymes that break down and neutralize harmful substances. Sulfur is crucial for the synthesis of glutathione, a critical antioxidant that the liver needs for effective detoxification. While sulfur can be obtained from animal sources such as beef, poultry, and fish, these foods may also carry residues of animal medications and pesticides, which are best avoided during detox periods. A healthier alternative for obtaining sulfur is through allium vegetables like garlic, onions, shallots, scallions, leeks, and chives. These vegetables not only provide sulfur but also come with a host of benefits including antibacterial, antiviral, antioxidant, anti-inflammatory, and immune-boosting properties. Number 3. Omega-3 fatty acids. Omega-3 fatty acids are crucial for liver health, particularly in combating conditions such as fatty liver and NASH, non-alcoholic steatohepatitis. Research has demonstrated that a diet rich in omega-3s can significantly reduce liver fat and improve liver enzyme levels, aiding in the restoration of liver function. There are 3 essential types of omega-3 fatty acids needed for optimal health: ALA, alpha-linolenic acid, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These fatty acids play a key role in reducing inflammation and supporting cellular health. The best sources of omega-3s, particularly ALA, are found in plant-based foods. These include seaweed and algae varieties such as wakame, nori, kombu, and spirulina. Other excellent sources are chia seeds, hemp seeds, flax seeds, walnuts, edamame, tofu, tempeh, kidney beans, and so on. In olive oil, these foods provide substantial amounts of omega-3s without the need to consume fish. During a detox phase, it's advisable to avoid ocean fish and fish oils, as they might contain pollutants that constrain the liver. Instead, focusing on plant-based sources ensures that you get the necessary fatty acids without additional toxins, supporting your liver in the detoxification process effectively. Number 4. Herbs and supplements. Enhancing liver health can also be significantly supported through the use of specific herbs and supplements, with milk thistle and dandelion roots standing out for their proven benefits. Milk thistle is highly regarded for its liver protective qualities, primarily due to the active compound salmonerin. Salmonerin acts as a potent antioxidant that not only blocks toxins from entering liver cells but also aids in the detoxification process. It helps to repair liver cells damaged by inflammation or pollution. Artichokes are another rich source of salmonerin, providing a food-based option for incorporating this beneficial compound into your diet. Known for its therapeutic properties, dandelion root offers significant benefits for liver function. It has been shown to reduce oxidative stress in the liver, which is crucial for preventing long-term damage. Additionally, dandelion root supports the production of glutathione, a critical antioxidant that the liver needs for detoxification. It also enhances the levels of a specific liver enzyme that improves insulin sensitivity and helps to reduce fat accumulation in the liver. Number 5. Antioxidant-rich foods. Antioxidants play a crucial role in maintaining liver health by neutralizing free radicals, which can damage cells throughout the body, including those in the liver. Incorporating antioxidant-rich foods into your diet is vital for detoxifying the liver and enhancing its functionality. Grapefruits. This citrus fruit is particularly beneficial for the liver due to its high content of naringenin, and naringenin powerful antioxidants known for their ability to combat chronic inflammation and prevent liver scarring. Additionally, grapefruit is an excellent source of quercetin, an antioxidant that has been shown to significantly improve liver inflammation and reduce fat accumulation in the liver. Beyond grapefruits, other dietary sources of quercetin include capers, red onions, and darkly pigmented fruits such as blueberries, grapes, apples, and cherries. Vegetables such as spinach, asparagus, sweet peppers, and broccoli are also good sources of this beneficial antioxidant. Another key antioxidant, resveratrol, has notable liver benefits. It has been shown to reduce fat buildup in the liver, decrease liver fibrosis, protect against oxidative damage, and even possess anti-cancer properties that can target liver cancer cells. Foods rich in resveratrol include grapes, peanuts, cacao, pistachios, blueberries, and cranberries. Number 6. Choline. Choline stands out as a critical nutrient in the fight against fatty liver disease. This essential nutrient is vital for several bodily functions, particularly for its role in liver health. Choline is predominantly found in egg yolks and beef liver, two rich sources that can significantly boost your dietary intake. It plays a crucial role in liver metabolism by aiding in the removal of excess fats from the liver, thereby preventing fat accumulation that can lead to fatty liver disease. It's particularly important for postmenopausal women to ensure they receive adequate choline in their diet. This demographic is often at higher risk for developing fatty liver disease, making choline consumption even more critical. Additionally, controlling overeating habits, such as stress eating, is essential for preventing weight gain and managing diabetes conditions closely linked to fatty liver disease. At least 50% of individuals with diabetes are found to have fatty liver, underscoring the intertwined nature of these metabolic issues. Research indicates that one of the primary pathways through which non-alcoholic fatty liver, NAFL, develops is insulin resistance, the fundamental cause of diabetes. Thus, incorporating choline into your diet while managing your eating behaviors can play a pivotal role in preventing and managing fatty liver disease. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Hi everyone. Ask any nutrition expert about the healthiest foods to eat and they'll surely mention seafood, especially fatty fish like salmon. What is it about seafood that makes it such a popular choice among fitness nuts? In today's video, we're going to talk about 13 impressive health benefits of salmon, and why you should include it in your regular diet. Is it because salmon is high in vitamin B? What makes it good for your eyesight? What impact does salmon have over your blood cholesterol levels? We'll be talking about all of these and more. 1. High in B vitamins. Salmon is a great source of B vitamins. A serving of 100 grams will give you more than 100% of your daily requirement of B12. It also gives you more than half of the vitamin B6 you need on a daily basis. It's rich in other nutrients such as niacin, riboflavin, folic acid, and thiamine. These vitamins help convert the food you eat into energy your body can use. They also help in repairing your DNA and bringing down the chances of chronic inflammation, which in turn can reduce the risk of disease. Have you ever checked your vitamin B12 levels? Do you make sure you eat foods rich in this important vitamin? Share your thoughts with the community in the comments below. 2. Contains astaxanthin. Astaxanthin provides a lot of benefits. It's one of the reasons why salmon has its red color. This particular compound can bring down the amount of LDL or bad cholesterol, and raise the amount of HDL or good cholesterol. There are many other benefits of astaxanthin. It brings down inflammation and reduces oxidative stress. It also protects your arteries from plaque buildup, which means you have a lesser chance of suffering a heart disease. Astaxanthin also reduces the chances of skin damage, which would make you look a lot younger. With every 100 grams of salmon, you get as much as 4 milligrams of astaxanthin. Looking for answers on all the latest health and wellness news? Hit that subscribe button, and join our millions of followers, including heart disease, cancer, and diabetes. 3. Consuming salmon on a regular basis can help bring down the risk of inflammation. In one study among more than 400 participants, it was seen that eating fish can reduce the levels of white blood cells in the body. The level of white blood cells is generally seen as a measure of chronic inflammation. Further research has shown that fish oil supplements can have a major impact on several markers related to inflammation. 4. Rich in omega-3 fatty acids. Fish, especially salmon, is a rich source of omega-3 fatty acids, especially EPA and DHA. These fatty acids are not created by your body, so you need to get them from your diet. About 100 grams of farmed salmon can give you about 2-3 grams of fatty acid, while the same amount of wild salmon can give you 2. It's recommended you get anywhere between 200 and 250 milligrams to 1,000 milligrams of EPA and DHA a day. Eating 2 servings a day will give you the fatty acids you need. EPA and DHA are important to your body as they reduce your chances of cancer and lower your blood pressure. Research has shown using EPA and DHA supplements improves the function of your arteries. This was especially beneficial to people who smoke a lot, are overweight, and have high cholesterol levels. 5. Loaded with selenium. Your body needs selenium in trace levels, but even those small amounts need to be in your diet. Salmon is a great way to get the selenium you need. For every 100 grams of salmon, you'll get 75 to 85% of the selenium your body needs on a daily basis. Selenium can help increase your bone health and reduce the chances of cancer. Research has shown eating salmon and other selenium-rich foods can increase the selenium levels in your blood. This nutrient plays a very important role in thyroid hormone metabolism, reproduction, DNA, and more. 6. May protect brain health. Salmon can even help improve your brain health. In fact, fatty fish and fish oil are shown to reduce symptoms of depression and anxiety. Also, having fatty fish while you're pregnant can help protect the fetal brain. In one study of more than 500 older adults, it was seen that eating 1 serving of fish every week can reduce the rate of cognitive decline. Fatty fish can also bring down your chances of dementia and age-related memory loss. 7. May reduce the risk of heart disease. Eating salmon can help reduce your chances of heart disease. This is because salmon can increase 3 fatty acids in your blood. In most cases, people have a lot more omega-6 fatty acids in their blood compared to omega-3. Research shows that when the balance between the two is unequal, there's a higher chance of heart disease. In one study, it was seen that 2 servings of farmed salmon a week increased the levels of omega-3 fatty acids in the blood up to 9% after 4 weeks, while at the same time decreasing the levels of omega-3 fatty acids. 8. Great source of protein. Salmon is one of the best sources of protein you can get in your diet. Protein is a very necessary nutrient for your body, as it can heal your injuries and maintain your muscle mass as you get older. It also protects the health of your bones. 100-gram serving of salmon can give you up to 25 grams of protein. Research has shown that to maintain your health, you need to get 20 to 30 grams of protein from your diet. 9. Good source of potassium. Salmon is also a great source of potassium. For every 100 grams of wild salmon, you can get as much as 13% of the potassium you need on a daily basis. For the same amount of farmed salmon, you get 8% of this nutrient. Wild salmon gives you more potassium than a medium-sized banana. Potassium is necessary for your body, as it can help bring down your blood pressure levels and reduce your chances of stroke. One review showed that potassium helped people suffering with high blood pressure. 10. May benefit weight management. When you have salmon as part of your diet, it can help you lose weight. Because of the protein present in salmon, it will help regulate the hormones that control your appetite and keep you full for a longer period of time. Also, when you eat protein-rich foods, it can increase your metabolism rate. Research has shown that eating salmon and other fatty fish can decrease belly fat among people who are overweight. 11. Helps you sleep. Salmon gives you an important amino acid called tryptophan. You have to get this essential amino acid from your diet as it doesn't produce it. Tryptophan is very important because it helps your body make melatonin and serotonin. Wondering what these are? Well, melatonin is very crucial for sleep regulation. It's a hormone responsible for the sleep-wake cycle of your body. If there's no melatonin, you won't be able to sleep. People with sleep irregularities can try and eat melatonin-boosting foods like salmon for a good night's sleep. Serotonin, on the other hand, is a mood-regulating hormone. When your body lacks this hormone, you deal with mental health issues like depression. 12. Good for your eyes. If you're not getting enough vitamin A from your diet, you should definitely consider adding salmon. Salmon is loaded with vitamin A, which is not only super good for your immune system, but also boosts your eye health. Vitamin A plays a crucial role in vision by maintaining a clear cornea, which is the outside covering of your eye. This vitamin is also a component of an important protein in your eyes that allows you to see in low light conditions. Vitamin A deficiency, if left unchecked, can lead to a serious condition that begins with night blindness. If your vitamin A deficiency continues, your tear ducts and eyes can dry out. Eventually, your cornea softens, resulting in irreversible blindness. So, eat more salmon if you want healthy eyesight. 13. Delicious and versatile, salmon has a unique flavor. Compared with other fatty fish, such as sardines or mackerel, it doesn't have the typical fishy flavor you would associate with seafood. Along with the flavor, it can be cooked in a wide variety of ways, including steamed, smoked, and grilled. Canned salmon can also provide the same health benefits as fresh salmon. Not only is canned salmon cheap, it also lasts longer. While having a similar nutritional profile as wild salmon, canned salmon can be substituted for tuna when you're making a tuna salad with healthy mayo. One of the best and healthiest ways to eat salmon is to steam or grill it. Salmon salad is not only highly nutritious, but also very tasty. Interested in knowing more about nutritious foods and their health benefits? Sure, salmon is good, but what about others? Do you eat salmon regularly? Are you planning on eating more after watching this video? Let us know in the comments below.